A topic that we've discussed before, and we have to revisit it: insulin, friend or foe. So many people know exactly what insulin is, but we want to expand and just rerun this because people don't know. And you don't know what you don't know. So here we are, Yvette, and we're going to do this masterclass of everything we know about insulin and just grind it to the ground so that everybody can understand.
Yeah, it's a very interesting topic, Johan. And the fascinating part is we actually are learning more and more and more about insulin as time goes by. Because if you and I go back to 20, 30 years, what they knew about it versus now is a vast difference and a big discovery. And I think probably one of the most important things for us to know is how important is insulin. So this is where I think we're going to do Q&A today, and I'm going to ask you, how important is insulin for our bodies? Because what does it do?
Insulin, and one thing that you mentioned in a previous podcast, without insulin, you'll die. And that is where the type 1 diabetics come in, where they either don't make insulin at all, or they've got a vast diminished secretion of the insulin, and these people are usually skinny, they're always tired, and they pee a lot. And that is actually how they discovered diabetes, because in the old way, I'm so glad, Yvette, we don't have to test for if somebody has diabetes like the way they used to, where they had to taste someone's pee to say, oh, you've got sugar in your urine. So I'm really glad we don't have to do that anymore.
Yes, for sure.
But insulin is very important. One of the main functions of insulin in your body is to transport glucose as a fuel into the cells in order to create ATP, energy in the mitochondria. So that is to create energy is a very important function of insulin. Just if you think about survival of the human body. One thing that is also important is for the human body to store energy. If you think back, and one thing that always comes to mind is the Bushmen in South Africa. Not the new Bushmen who transitioned into the cities, the guys with a little around their waist loincloth and the bow and arrow, and they're hunting through the desert trying to find an animal. What they would do is, if they find an animal to eat, they'll hunt it and they'll eat the entire animal. They'll go from looking like a skeleton to a severely pregnant woman after they ate, because they'll eat the whole thing. They can't leave over. They can't store it. They don't have refrigerators. They don't have salt to salt the meat and keep it over for the next week. They eat the whole thing. And what do they do with all of that meat and fat? Because they eat all of the fat, because they know that is where the energy is. And one thing that insulin does is to help us to preserve the energy, to save that energy for later, so that in case there is a famine, that we can tap into those stores and use that energy for survival. But what has happened lately in our modern age, in us not living in the Sahara Desert, not having to hunt for our food, not having to burrow under trees for roots to feed ourselves.
Well, we've been having a overconsumption.
Food is so available that we don't have to worry about where the next meal is going to come from. Some people say, oh yes, but there is people who have to worry about where the next meal is coming from. And I agree, and that's not what I'm talking about. I'm talking about average humans who have food available to them most of the time. And you don't have, now you're storing that energy, but you don't need to store it, because tomorrow, this evening, you're going to eat again.
And you know, the thing is that the visualization that I always found compelling was the 2 teaspoons of sugar is literally what our body in our blood can accommodate. Anything above that, then insulin really has to come and do cleanup. There is a part of it that's got to get stored as for the energy, which we would call fat storage, but literally it's energy storage for later consumption. But then you get across that fine line when it's not those 2 teaspoons of sugar in your blood anymore, it's more. And that
Yes,
is actually toxic.
true. And one thing that I want to mention, because you think insulin only gets secreted after you've eaten. But as a matter of fact, there are studies that show that even thinking about the meal that you're about to consume, you already secrete a little bit, not a whole lot, but like a starter dose of insulin into your blood. And that happens through your vagus nerve. And once you eat that meal, whatever it is, there's already a little bit of insulin there to accommodate whatever carbohydrate might have been in that meal. And, it's not always the carbohydrates that we eat. That's the main thing. That's definitely the main thing. But sometimes the glycogen that gets released through your liver and your muscles also provide glucose in your bloodstream. And you need insulin to get the glucose into the cells to create the energy. So insulin plays a very important role, but insulin does not have to be high all the time.
Now, that was my next question. So if you have elevated insulin the whole time, that's when we see issues. For example, everybody knows of the terminology insulin resistance, but do they really understand what it means?
Yes, that is a very important subject. Insulin is what they call an incretin hormone. And in essence, for the people who want to be really into it, it can also be a peptide. But insulin, as a hormone, think about all the hormones in your body. There's not a single one of your hormones that is high all the time. Does not get switched on. There's no glandular tissue in your body that will secrete a hormone to be on all the time, even male testosterone. Although many people think, oh, look at that guy, his testosterone must be high all the time. No. In a 24-hour cycle, that testosterone is really high early in the morning, then it tapers off to almost nothing. So there is a cycle in everything. Female hormones, there's cycles to it. It gets secreted, then it gets burned down. Thyroid hormone, the same thing. There's so many hormones that you can mention that all of them have pulses, just like insulin. Insulin is only supposed to get secreted when you eat, and when you eat mostly a carbohydrate meal. You do get some insulin secretion when you eat protein, but you don't get any insulin secretion when you eat fat,
And
which is
that's also
amazing.
that's the interesting part there is though, because there's 2 things here. We've been encouraged over the last 20, 30, 40 years that we've got to eat 4, 5 times a day. So if we are now thinking that every time you eat, insulin is going to be secreted, because we're talking standard American diet, okay? Because there's no ways you and I can eat 5 times a day. That's not going to, I do not have place for that. But that in itself then is an issue, because now you are causing your insulin to be constantly secreted. And then the other thing that you and I have always spoken to, and we encourage people to do, is have your doctor do a fasting insulin blood work. 99% of them will say, oh, we do that. And you should say, no, not a fasting glucose, a fasting insulin. That will really help.
I so agree. In all the blood work that I've ever done with my doctor, they have tested A1C, which is basically, in short, it gives you information about how well your glucose control was over the past 3 months. So it's a very handy tool. A fasting glucose is a handy tool too. On its own, it does not really mean much. But a fasting insulin can give you a very clear picture of the level of insulin resistance you might already experience. And that fasting insulin means you have to be at least fasted for 12 hours. If you have not been fasted for 12 hours, the picture is not that clear. And with fasting insulin, we like it to be around 6 or less. Anything above 6, there might be indications of some form of insulin resistance already. And if it's above 12, there's a problem.
Big
There's a
problem.
big problem.
And then the other thing too, and like I said, we are still constantly learning more and more about insulin, that the constant elevated insulin, majority of those people will have high inflammation. They'll have
Yes.
aches and pains in places. It's not the same for everybody, but they'll have these aches and pains in their joints. And then all of a sudden, when you do get them to bring this constant high of insulin down, all these other aches and pains and things start getting better. So
Yes.
it's another reason why please don't eat 5 times a day. Let the body secrete the insulin and do what it needs to do to store it after you've eaten, but don't keep it constantly high.
I'm going to put up a graph
Huh?
of the insulin and meal period. And you can see, if you look at that graph, how the pulse-like insulin secretion actually translates.
Mm-hmm.
And if you think now, because insulin follows glucose, the glucose get high first before the insulin secretion actually goes up. The same happens when the glucose starts to go down. So now the glucose starts to go down, insulin is still a little bit high before it starts to take a dip. But now what happens is these people, and I have to unfortunately say there's some dietitians who will tell these type 2 diabetic patients, you have to eat your breakfast. 2 hours later, make sure you have a snack. Make sure there's enough fiber in what comes with that fiber snack. Loads of carbohydrate. So 2 hours later, just as your insulin is now ready to come down, all of a sudden you eat again. So your insulin says, here comes another load. No, don't go down. Stay high. Those poor beta cells don't know what's coming. They just keep on secreting. And now, over a 24-hour period, the only time your body has a really time to relax is at night when you sleep because, well, most people don't eat while they sleep. There might be some, but I know I don't. So now your insulin has time to go down a bit. But what happens 6-8 hours after you wake up? When you wake up, you eat again.
Yeah.
And up goes the insulin again. And what happens? How the big thing that people don't understand about insulin resistance, I feel, is the way it happens. It's almost, I want to compare it to addiction.
Mm-hmm.
Because if you look at addiction, people who are addicted to a drug, they first take it to get high. But once they take it more and more and more, now they start taking it to feel normal.
Yeah. And I think you can compare that, for example, we've spoken about that before, an alcoholic. Okay. So if that alcoholic has been, like you said, initially to get the little tipsy feeling, but later on it starts becoming an issue of feeling normal. So to make an alcoholic feel normal, they give them a shot of whatever. I remember when I was in the hospital many, many years ago, we had to do that with the alcoholics because we couldn't just let them go cold turkey. That would be detrimental. So now we're doing the same thing with insulin, okay? Because it releases, we eat again. It releases, we eat again. But what do we do in our side of the world with medicine? Instead of taking control of that food, we add more insulin. Now you're going to
Yes.
inject it.
And it's not only the injection, Yvette, because these people come to the doctor and they get diagnosed with type 2 diabetes, and they only start treating them after their A1C of 6.4,
It's been a long
which
time already.
it's way too late.
Yep.
It's way too late.
Yeah.
And then they give them these oral medicines. Obviously, they first start with metformin, which probably not, of all of them, one of the safer ones, makes you feel miserable because you throw up and you poop and you don't know which way it's going to come out. But then they also give these other things which actually stimulate your beta cells to make more insulin. You already have enough insulin. You're already insulin resistant. And what happens with the insulin receptors, this is a very interesting science. If you can maybe get this visual.
Mm-hmm.
If you have normal levels of insulin, let's say your cell have 10 receptors. So the normal level of insulin probably will not fill each of those 10 receptors, and the cell will be happy. Say, I get just enough sugar in, make my ATP happy, make my mitochondria happier. This is fine. It's just dandy. But now, if you have these high levels of insulin,
Mm-hmm.
the 12, that cell's nucleus starts telling the cell membrane, you know what? I think there's too many receptors. So now you downregulate those receptors. And the cell membrane kind of suck those insulin receptors in so that there's not that many receptors available on the outer membrane
Mm-hmm.
for the insulin to bind. It does not tell your body, oh, you've got too much sugar. It says there's too much insulin because the sugar that you eat comes from the outside. It does not come from inside the body. So the body can only deal with what's happening, what's naturally inside the body. So what it tells the cell, okay, take away those insulin receptors. So now the blood sugar don't go down. And what does our body tell our brain? Is you know what? There's not enough insulin, but it's actually less insulin receptors. So your body makes more insulin. So high insulin creates insulin resistance, and insulin resistance creates high insulin.
Yeah. And it's
So it's an evil cycle.
Yeah, but I was going to say that evil cycle, it goes around and around, and nobody ever stops and goes, okay, what is the cause of this again? It's your body trying to remove the sugars from the blood that needs to be stored for energy, used for energy, or to detoxify you. Otherwise, you're going to die. I've seen people with extremely high sugar numbers and they just go pass out. They're in a coma. If they don't get given insulin shots immediately, and treat it like that. But it's so heartbreaking that we are in a part of the Western medicine where we add more versus taking away. And it's kind of sometimes when I speak to a patient and I know medicine's expensive. I know some people can't afford things. And then you get this whole thing of, well, then I'm just going to die because I can't afford it. And I must sound like a person from Mars when I pop in and say, has anybody ever spoken to you about changing your diet? No. That's unheard of. So once you know the importance of insulin, you understand how good it is. We really, it's fantastic. But do you really want to push your body to the point where your own insulin is useless and then you have to start injecting? Because we're talking about a lot of type 2 diabetics using insulin.
Yes, and
That's unnecessary.
I have a type 2 diabetic, really nice guy, and the doctor just put him on a GLP-1 medicine, which I think we're not big fans of it, although on the other hand, for this patient, it was a brilliant idea because he's taking him off of his long-acting insulin. And he's a type 2. So I told him, this is the best thing that ever can happen to you. is to stop that because he was taking high doses of glargine insulin. And I told him this is the worst thing, because one doctor that we listened to, and I will never forget that, if you're a type 2 diabetic and your doctor gives you insulin, it's just fast tracking you to your death. And I thought that was a bit harsh, but it wasn't me saying it. I can't remember who the doctor is, but that's what I heard. But he's probably not that far off.
Well, the thing is, this is the part about insulin when we, as pharmacists, that I've always, for years and years, I would tell patients, when you start on an insulin, you're probably going to gain about 10 pounds. And I have listened to pharmacists counsel patients and not telling them that. So if you understand the biology behind it, you understand why. And only when you tell people you're going to gain weight because we're giving you, but why? It's because many, many years ago, insulin was actually called the fat storage hormone before they knew a lot about it. So think for yourself, fat storage hormone. So I must be eating food that this hormone's got to store. So if I don't eat those foods, this hormone can't store it. So kind of coming back to our thing of common sense. But it's only when you speak to patients like that and say, this is what can happen. And Johanna, in my experience, I have seen people start with, I'm talking about the before meal insulins. Let's just call it like that. 5, 6, 7 units. And before you know it, they're doing 30 units before each meal, 50 units before each meal. And there's never a question asked, like, why do I need more? Because you haven't changed your diet. It's not your body. You've put it there and you've caused that harm. So the only way to remove it is to remove the cause.
Absolutely. And one of the things that we do in our practice, Yvette, is really to work with your body's own biology. And your body is an amazing piece of equipment that responds very well to different stimuli. So if you're going to give it sugar, it knows, okay, we need to secrete insulin. If you take that away, your body doesn't say, there's no sugar. Let's just do a little bit, maybe 10 units just to see if everything is still okay, everything is still balancing where it is. But it is easier and to go get a prescription for whatever diabetic medicine than to change our diet. And because grandma's been eating this, my mom's been eating this, so why should I not eat it? And unfortunately, we've discussed this before. There's not a lot of the genetics being passed down from generation to generation, but there's a lot of diet being passed down from generation to generation. And unfortunately, the bread that grandma baked in her own oven is not the same as we have in our stores today.
Yeah, the food is definitely so much different. And then a lot of people will say, yeah, but why? Like 100 years ago, people could eat like that and it wasn't a problem. Well, if you've listened to Johan and I, you'll know seed oils, the flours, the hybridization, the way things have been homogenized, and the things we took and said, this isn't good, so we're going to change it and change the formula in the food. That's what makes the difference. So for us to get better results, we have to make drastic changes. Unfortunately, it's not just a little bit of a change. There's literally, if your health is a priority, if you have any kind of predisposition to seeing elevated A1C numbers, like Johan and I say, if those numbers are elevated now, you've already had an issue a long time ago. Do not BS yourself with that. It didn't happen yesterday.
No.
For sure.
It's not like you eat a chocolate cake tonight and tomorrow you're a diabetic.
Definitely not.
No.
But again, when we come back to the question of, is insulin a friend or foe? It depends on how you look at it.
Depends on the dose. It's like a toxicologist, the first thing they'll tell you, the poison is in the dose. And that is exactly the same thing with insulin. The poison is in the dose. And if you're insulin is high all the time. It means there's something that you need to do like right now. And type 2 diabetes can be reversed. We've seen it. So some people it needs fasting, some people needs a little more intervention, but it is totally possible and everybody is unique. So the number one thing that we want to drive home today is have your fasting insulin tested, not your fasting glucose, fasting insulin.
And a little piece I want to touch on, I don't want to go too deep into that, but type 3 diabetes, constant elevated insulin, preventing the energy sources, whether it be ketones or glucose, to go to the brain. And we're having such a very massive incline in cognitive failures, dementia, Alzheimer's diseases, all of those. Those are all precursors. We are finding and learning more and more about that. And one thing that I've noticed, you've noticed, we have people in our programs or journeys, as we call it. The one thing people immediately say is, you know what? My brain fog is so much better. My cognitive function, my retention of information. So what does that mean? That means that constant high insulin definitely plays a role. Now, there's a lot of things that we still don't know about it, but I can tell you for a fact out of personal experience, when those numbers came down, I was like, I woke up in the morning and I didn't have that, I got to wake up. I was awake. My brain's working, fully functioning. And Johan, you have the similar experience, like when that switch happened, it's like, I can think.
Absolutely. And we've seen it firsthand with clients too, where on day one, you have to repeat things over and over again, and they don't ask any questions. And day 50, all of a sudden, it's like, but I want to know more about this. I want to know, how does that work? Oh, so that's how it works. It's just amazing to see how people come alive once they go through one of these journeys of us. And now talking about, let's talk about Alzheimer's just a little bit. Because that is anybody who goes through it and the people who care for those patients. I have a big heart for them because it is not easy. And there's a lot of research in the early 80s that started where they found by autopsy of these people, they found that there is a thing that they called myelin plaque in the brain. Now there's studies coming out, very recent, where they found that there are people, almost everybody has myelin plaque, but there's people with the same amount of myelin plaque with no cognitive decline. And there's a lot of focus now being that there might be an energy metabolism imbalance in the brain that's causing that cognitive decline. And one of the big things, that's why they call it diabetes type 3, is vast insulin resistance in the brain tissue. That is one of the biggest determining factors of cognitive decline. When there's insulin resistance in the brain, they might not even find it. Your A1C might still be fine. But many times, as we have spoken in the past, your eye, for one, is very sensitive to insulin resistance, as is your brain. Sometimes, not even sometimes, I want to say always, that low-level insulin resistance that you might have, the rest of your body might not experience it, but you might experience it in the form of a depression, in form of you can't remember that well anymore, and hyperactivity, you can't focus. And many times, if you improve that energy metabolism in the brain by feeding it a little bit more ketones than glucose, it actually has a vast improvement, really a day and night improvement. Not that we're saying that all these conditions are related to energy metabolism, but if you want to prevent that from ever happening to you, you might really want to consider what you're feeding your brain.
And then with what you were saying is that, well, there is the small capillaries, like we're saying, especially with the eyes. For a very, very long time, when people had any of these deposits in the eyes and the small capillaries, it was believed and thought that it was irreversible. And they've actually found the opposite now. That there are patients that if these deposits were done due to the high insulin resistance, or like you say, a low-grade insulin resistance, it's not picked up anywhere else but it's picked up in the eyes, that has been reversed when they do start changing what they eat and lowering the amount of insulin being reduced. So that's fantastic. It's also the same with the neuropathies, the diabetic neuropathies, which was previously doomed as an absolute death sentence, has now been shown that new blood flow, new blood vessels, new development there, some of those would die down and there would be tissue that would be regained. So it's positive, it's uplifting, and knowing that the body can restore that is what really makes it hopeful.
Yeah, for sure. And in short, they always, in our field, we talk a lot about prevention and cure. Now, in many ways, we can actually almost say that the prevention is the cure. Because if you follow all the prevention techniques, if you already have that low grade of insulin resistance, you can reverse it. But we cannot talk about cure. And we are only here to educate and give people information on how to prevent a future catastrophe. But it would be great if we can get more people happy and healthy.
And that's where I would maybe this throw a little bit of a spanner in the works. If you think going to the doctor every year for a preventative yearly visit, that going to the doctor, that does nothing. If you don't make any changes based on what you found there, you can go to all the preventative checkups you want, but it's ultimately up to you. Okay,
Yes.
I did see there was something wrong, and it doesn't mean you add a new drug. No, this is not what Johan and I are talking about. We are talking about you go, you get this health check, and you see, okay, things are not going the way I'm expecting. So stop doing the things that you would do and start doing something different. Start taking care, like you were saying, the whole thing about the cure, although we can't say it's the cure, but that's where you're going to have to start working backwards instead of adding more things, but fixing what you've done. So it's an
Yes.
important thing to don't think that checkup, it's not a health checkup. It's a wake-up call.
That's so true. That is so true. It's a wake-up call. And rather go and get all the blood panels and stuff done with the intent to see how healthy you are.
And if you're missing a few of the ones that can really give you clues, reach out to us. We can tell you, because the standard average ones where you're going to come out there and, oh, my numbers look good. No, add the right ones, the ones that there's no drugs for. The only thing that can fix it is going to be your lifestyle.
Yeah, for sure. Because most labs that are done with the sole purpose to produce a prescription at the end. And those are not the ones we talk about. We're talking about the things where only lifestyle can fix it. And if you need help with that, we post our calendar links in the show notes after each episode. Reach out. We'll be glad to help you.
It'll only be our pleasure, because if there's one thing Johan and I absolutely live for, is somebody that being so grateful for having achieved something that they thought was absolutely unattainable, because that's what they've been told. So
Yes.
if that is you, please reach out to us. We really want to help. That'll make a big difference in your life and your families, and if you have children, in their lives.
Definitely. Because then you can pass down that diet again, or
Mhm.
that even that information where your kids will see what you're doing and how healthy you are, and they might actually pick up some of your good habits to carry on to their children. So then that way you can create generational health and not just health for right now.
I love what you were saying there, because it's quite interesting how our kids can sometimes take our good habits and our bad ones. So it really is a bit of an eye-opener if we can live them with good habits, ones that
For sure.
change our lives, not the bad ones.
Yeah, definitely.
This has been awesome for us, Johan. And I'm sorry that we have to go now. Johan fell off the table there.
Yes.
But this is a brilliant topic for people to understand. Insulin is a good thing. Too much insulin is a bad thing. And, the importance of it. But what ultimately causes insulin to be stimulated. So that's the kind of stuff. It's been great. Really enjoyed that.
Yes. Thank you, everybody. And please hit that subscribe button and like this video. And we'll see you on the next one. Take care.
Take care. Bye.
Views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife nutritionals, beauty, and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.